So the culture stems from the people at the top of the business. If you have a toxic culture, that can tend to filter down. I very much say that I'll get in the trenches with you. When it's all hands to the deck, I'm very much in that position. To see the team how happy they are is the most important thing for us, because we know that the standard of care they're delivering is high, and that's what sets us apart.
One thing is getting the right people through the door when you're looking at recruiting the right talent into health and social care. But equally, if not more important, is making sure you retain those people. So that's a discussion for today, and we're very fortunate to have Nathan East with us to talk about that. He brings loads of experience from different areas, particularly his most recent business. So let's get on with the chat.
Firstly, thanks for having me on. It's an absolute honour to be on the podcast today.
Brilliant stuff.
Nice to have you. So, let's start off, Nathan. Give us a little bit of background on you, for people that don't know you.
Bit of background. Well, like you said, what have I not done? So, started out early 2000s, not long after kind of the internet boom with online, recruitment advertising moving from newspapers to digital. So I started working for Total Jobs Group, CW Jobs, which was an amazing experience. Pre that, everything was kind of press related, field sales. And then gradually moved through there. Then worked for read.co.uk when that was a free platform, moving to a paid for platform. So as part of the kind of launch in the early stages of that, which was great experience. Then we obviously went into the financial crisis at that point in the early stages. So that was quite a challenge from a sales perspective, and staying kind of motivated and getting through that. And then onto another job board, My Job Group, which was quite a short stint. It wasn't really the right platform for me. And then from there, I had the opportunity. I reached out to Indeed. Somebody who was a head of resourcing gave me a tip off and said, look at this platform. It's going to be big in the UK. I'm like, interesting. So I reached out to 100%. And for me personally, it's one of the best decisions I ever made. I've worked for some really good companies, but for Indeed, they were amazing. And started working with them. There was 5 of us based in Charlotte Street in the early stages. So we were working across UK and EMEA, and basically working with companies, trying to convince them that, job boards are no longer the future and that pay-per-click advertising is the future. And that was a fantastic experience for me. I think for me as an individual and a salesperson, it was a good breeding ground, because it was really hard graft, trying to convince people to move away. And also along the way meeting some really, really good people and getting a good insight to where I'm at now. So I kind of position myself as being the healthcare specialist at Indeed, because I see it being quite a fruitful market, purely from a sales perspective, because these businesses, they've got problems with recruitment and they're all kind of competing in the same job board, whereas I had something that was revolutionary, and they're also getting something for free. So I went down the route of specialising with like healthcare providers, and did that for about 4.5 years, and then moved into a home care business. So when I was at Indeed, I always wanted to work in a home care company, and it was about timing for me really, and positioning myself to be able to get into the position to be able to buy a business and do that. And so I've had my company now along with my wife, so she's one of the other managing directors. We're coming into year 5, which will be January. And it's been an experience coming from a media background where I knew everything about solving problems and helping people get jobs. Yeah. And then moving into more the actual home care side of it was a complete game changer. Is that when I was working with home care companies and mental health hospitals, and all different like home care care businesses across the UK, I was looking at it from one kind of perspective, and it's like, this is what I could see. This is where they need the help and the solution. And for me, that's where my natural transition was, moving away from media to then moving into working in this business. So I already had a good footstep in, whereas some owners who move into healthcare or home care, they tend to don't tend to come with the background of working within that sector and knowing what's out there. They're very much they've either been business people before, or they've worked in a job and this is new to them and they want to work in health and social care.
That interesting. So when I first met you, I was told that you were Mr. Healthcare. So you were working for Indeed at the time. I was working for an ad agency, and I think I was a bit of a know-it-all. So I was very protective of my clients, and I was a bit like, hold on, hands off. I know what I'm doing. You back off there. when I met you a second time, I thought it was going to be quite a quick meeting. And I was literally 2.5 hours later, my jaw was dropped, my eyes were wide open, my head spinning. Really annoyed that this guy just knows so much more than I do. Someone who knows everything. I'll be honest.
Yeah.
And then we worked together for a while. And you know, I was working for a healthcare company, and we filled a lot of vacancies. So when you decided to move into home care, your own thing, my instant thing was, well, he's going to have no problem attracting staff. Definitely not somebody I need to tap up and say, do you need any help? But as I learned when I was working for the healthcare company, it's not just about recruitment, is it? So it's not just about applications, and these are people and not numbers. So I bet your experience has been eye-opening, to say the least.
It has, and I think it was good experience working with you because you knew what you wanted as being one of my clients. So understanding your kind of processes and the way that you work. And I think what was interesting is our mindsets are very, very similar in terms of it's not about putting people into a position. It's more about how you retain and look after them and, you know, making them feel valued, making them feel like $1 million. And ultimately, that's the biggest thing is that, you know, recruitment is recruitment. You can put a job out there, you can get lots of applications or you can get a few applications, but it's about finding the right person initially. But when you find that right person, it's retaining them, because if you've got a problem and you look at a recruitment funnel and you start at the top and you load up and all of a sudden that funnel's got a massive hole in it and they're just falling out the side, the cost implications that has on a business is huge, because you've got to put them through induction, you've got to pay them for shadowing shifts, you've got all their uniform, you've got their DBSs, you've got their mileage, you've got all these costs, you know, the recruitment costs, you know, the office team that you're paying for them to get these people through the process. It does scale up, and you know, ultimately when you've done all the hard work, you want to keep these people, and that's the key. Is, you know, with any business, is retaining your staff.
Right. Actually, if you're not getting the right people in the first place, you're just kicking the problem down the road, aren't you? Really.
You are.
There's something you said actually about when we were having our green room chat about just like holding off just for a little bit longer to find the right people. There's a bit about that.
It's all about desperation.
Yeah. And totally. And one of the biggest things, because we're a husband and wife team, my wife Natalie, is that in a position, when you're in a business and you get into a position and you've had some levers for whatever reason they might be, for health or for change of career, because the health and social care sector is quite a challenging space. You know, everyone knows that. It's been in the spotlight for a very long time. So when you're running a business and you need this headcount, you know, making bad decisions and quick hires because you need to fill that position in order you feel that to move your business forward, sometimes is not the best foot forward. And it has, you know, that has had an impact on us in bad hires throughout our time of doing this. And the last conversation that Natalie and I had was that we're not going to rush this. It might put a little bit more pressure on the team, but if we go through this again, it's going to put even more pressure on, and you most probably end up having more levers. So with important roles for us, you know, like our registered manager, our coordinators, like our seniors, you know, these are important roles within a business, because it's not just, you know, myself and Natalie that, you know, is just running the whole business. We need people, you know, we need our team, and our team are our A players ultimately, because everyone is involved in the whole process. It's not just we're accountable for how well our business runs. So bad desperation hires does have an impact financially, but also what that looks to the wider team within your business as well. It's like, well, you can't retain staff. You know, where is the issue? Is that the company? Is it the culture? What is it that, you know, is a problem? And you're constantly, you know, hiring for the same types of roles. And it's very, very interesting actually on the way up here, driving up, I was thinking about when there was a stage within the recruitment sector where everyone would be across every single job board that was out there, and Indeed. So if you're using, you know, the traditional job boards, they've all got a job post on there, and then you've got it on Indeed, and then it's, you know, maybe some Facebook campaigns or something like that. To a job seeker, it looks like, you know, desperation, and that there's a problem there. So it's about how you kind of position that.
Yeah,
nice.
So it's interesting. I was speaking to a company that I met in America last week when I was at the health conference in Las Vegas.
Oh yeah, Vegas.
And
you can't talk about it. Was it what goes on in Vegas?
Apart from apparently.
That.
So I was speaking to an owner, very similar conversation, but he was saying, I only need 5 nursing managers, and I know exactly who I need. And we keep recruiting them, and they keep leaving. And so I was like, so what do you do differently next time? He's like, What do you mean? We use the same methods. We just get people in, they keep leaving. I'm like, so who says that they're the right people? And he's like, I know exactly who I need for this company. I know the culture. I'm like, with permission, do you not think that maybe you've got that wrong? And he was like, what do you mean? I said, well, if it was me, I would be asking your nurses why they joined, why they stay.
Yeah.
And he was like, oh, how did you come to knowing who the right people is for your company?
For me, it was down to kind of cultural element. So I think partly our recruitment process within our business has always been about how we interact at the interview stages. So initially what started to happen is that we're doing maybe a telephone interview. So I'd interview maybe half an hour, 40 minutes on a phone, chatting about it, then coming for a face-to-face interview, and then, meeting Natalie and myself, or possibly the registered manager as well. And then we would sit and go through the interview questions, and you'd get a feel for somebody. Yeah. I put my hands up. Maybe it's not always been the right thing, but coming back to, bad hires and stuff. Yeah. So what we tend to do now is that we added an extra layer in. So whether it's whatever skill set that is within our business, we would then invite them back for another interview, which will be more of a kind of practical. So giving you experience, care coordinators in home care companies are really hard to find. It's a really challenging role. It takes a certain type of person. In my mind, it's like you're good at chess in order to do that role. Not everyone can do it. So with our coordinator, who's amazing, she had a telephone interview with me, then she had a face-to-face, and then we brought her back in. No, because I'm useless at that. She would have won and got the job. So we set up, we had a demo part of our platform where she could show us rostering, how she was going to do that, looking at where gaps needed covering and stuff. So we actually put her through that kind of process, and that she's done really, really well within that role. And then if it was a different position, we'd look at maybe a form of a kind of presentation, how they're going to help the business, how they're going to help retain staff, because it's not all just about business growth. A care business can grow, but you can't grow if you haven't got the right people. And for us as a company, it's very much, our workforce at one point, the average age of the workforce was over 55. Because we look for experienced people. When we set up our care company, it's very much that I'm looking for people, if they were caring for my mum or my dad or my nan or my granddad, how do they come across to me and how do they make me feel if they were looking after my family member? And it kind of comes into their personality. Do they have empathy? Can we trust them? Do they want to make the client feel like $1 million? Because our company, we're very much a premium care provider. In our area, we're not the cheapest, but we're not the most expensive. But on the back of that, we've won multiple awards. And that comes down to our team. So we'd won WorkBuzz, like 5-star employer for 2022, 23 and 24. So that's an amazing accolade in a very short space to win, to come down. So that also ties into the whole retention piece. And for me, it's looking at what is it your team want? They want to know that you're approachable, that you value them. We kind of touched on it in the green room about open door policy. In some organisations, it's very much that if you're bringing new talent into the business, that it could be a carer turning up and the office team is heads down, no interaction, don't make you feel warm. You walk through that door. I always put myself in a position, if I was going to an interview and I was greeted like that, naturally that's put me on the back foot and you're not the company that I potentially want to work for. So the whole kind of the values of that person coming in from the start, from the person. So we have a recruiter who deals with all the telephone interviewing. So she's bubbly, she's outgoing, she's a little bit crazy, but in an amazing way. And people they buy into her because she's the first voice that the company kind of interacts with. So she will deal with the interview process, and the registered manager will go in and meet with the carer and then offer if they like the carer, or sometimes they might leave it 24 hours. But it's all depending on the kind of interview process, and then that moves over to the onboarding. So we have an onboarding lady who deals with all of that part of our business, and she's also amazing as well. She's been with us 2 years now. And it sets the scene, when recruiting, because recruitment's tough at the best of times. And retaining, like we're touching on, is very much tough as well. But this whole start from coming through the door to when you're onto it, like the caregiver induction, is the biggest piece, because this team are buying into you as a company. And also having, the awards that we've won for being a 5-star employer shows that we truly do care.
Nice.
I think the candidate experience that you just described there is something that I talk about all the time. Because even if you did have managers who may not be the most available or supportive, to put it very nicely, in probably a bigger company, but you've got people coming through, and even if that first week is a bit of a shock to the system, you know, they've not had the support from the manager. If they've had that candidate experience that's been, you know, gold standard, they're much more likely to stay and to feel like they can come and talk and open up and all that kind of stuff. But I think it's overlooked so often, because especially with bigger companies where a lot of things are automated, there's a high volume of applications, and it's kind of like, as soon as they've accepted the offer, it's kind of like, job done.
Yeah.
But there is so much work to do between an offer and somebody being 6 months. You'll agree that they're the right person, they're agreed that it's the right company. It's like, brilliant, we've got a great relationship and a great employee. There's a hell of a lot in there, and that's the valuable part, isn't it?
Yeah.
And actually, it's like you can have the best kind of recruitment marketing around, great content, right placements, and you're using all the right tactics. But then, if the experience falls off a cliff as soon as someone meets that first person, it's like a total waste of time. I think you talked about earlier on about, so that people listen to this, either kind of leaders of teams or high up in organisations. So I think, what kind of things can they do to be, I suppose, the best kind of leader of the people that they're working with, to then make sure that that feeling trickles through the organisation, ultimately you retain the people that are right for the business?
Yeah, that comes down to, like you touched on the top, right? So the culture stems from the people at the top of the business. If you have a toxic culture, that can tend to filter down. But very much for Natalie and myself, we're very outgoing people. We're very personable. We have a laugh and a joke in a professional way. But it's how you feel passionate about what it is that you actually do. So we're passionate about delivering a high standard of quality of care. We're passionate that we've got one of the most amazing care teams in Chichester and Bognor Regis. And our team know that, and I'm very vocal about it. We have a system that we use internally where we praise, recognition, awards, and being approachable is a key, because if you're kind of like in your office with your door shut and you never actually interact with your team, then they're going to be like, "Who is he?" They don't buy into your culture. And I think to run a really successful company is a team buy into what you do, and when you lead from the front. There's multiple times within our business journey, in both of the businesses that I've set up and run, I very much say that I'll get in the trenches with you. When it's all hands to the deck, I'm very much in that position. It's not like, that's your problem, you sort it out. And that's what our team really respects. So if you brought our team in, our office team, they would all say that how Natalie and I are so kind, caring, supportive of them, and feel that they are truly part of our family. So we call our business like our right at home family. And that's what is the most important thing. So it doesn't matter about seniority and where you are positioned within your business. As long as your team know that you care, and you care about what they do, and that you recognise for the hard work that they put in, that makes a real big difference to anybody. And that's what I felt over the years.
No, that's brilliant. You also talked about the space, the office space, and about the fact that it wasn't your space, it's their space as well. Because you deal with home care, domiciliary care, which can be a lonely job, potentially. Can you tell us a little bit about that?
Yeah, so obviously it's a lone working role. Unless they're working double-handed, the majority of the time they'll be out in the field. So when we set the company up originally, I wanted to have a space where it was inviting and that it's their space. So we kind of stretched ourselves in the early stages of setting up the business. Rather than going for a very small serviced office, we went for an office which was 900 square foot. So in the second lockdown in November, I was in there painting the office, getting it ready, putting all the infographics up, nice seating area. We have a nice coffee machine. We have, in the summer, a fridge freezer that I went out and brought, stocked up with ice pops, biscuits. As soon as somebody walks through the door, the front of what I call the front of house team, straight up, want tea, coffee. What kind of coffee? Starbucks, bean to cup, no Nescafe for me. But that again ties into my experiences over the years of going into domiciliary care businesses, like I kind of touched on. It's when you walk through that door, that first kind of, is this a good company? Am I going to be treated well? So our space is very much their space. And in the early stages, I used to run our caregiver induction. And very much in that point, I'm like, this is your office as much as it is my office and the team's office. Don't feel that you're a lone worker and you've got to be out in the field. If you have time between visits, do come in here and use this space. And we do. Friday afternoon, between sort of lunchtime and before next visits, sometimes chaos in our office. I'm the only male in the company out of an all-female workforce, so Friday afternoons is pretty much a write-off for me because I catch up with all the team, have a laugh and a joke, they come in and chat, and I love it because it makes me proud knowing that I've got such an amazing team along with Natalie, to see the team, how happy they are, is the most important thing for us because we know that the standard of care they're delivering is high, and that's what sets us apart.
The thing is, though, you think, and this isn't rocket science, is it? The way you describe it, this is just logical. If you get a job, it's normally a kind of entry-level type role, but it's challenging, and you join a job in care, unless you just fall into it by mistake, to give decent patient outcomes because it's a fulfilling, very worthwhile job, meaningful job. And if you're looked after and supported every part of the way, from even down to this kind of coffee, I was joking about it, but only because you said before, but the biscuits, the ice pops, the space, the support, the recognition, the praise, all of these things that you're saying, which are so often missed, all that's left, really, in terms of the job is to deliver quality care.
Yeah.
And if you had stuff that don't deliver quality care, then obviously you look at yourself and go, is there something more that we could do? And if not, then maybe it's not the right job for them. But if you've done all that you can do up to that point, and you've got the right people, you've taken the time, consider it to make sure you've got the right people, then it's set up for success. I think this is an amazing story of
Absolutely
what good looks like.
If you are leading a team, you're leading an organisation, what kind of things can I suppose you do yourself to set yourself up to be the best kind of leader that you can be?
Good question, that. So for me personally, it's always been about kind of looking after myself. We kind of touched on it earlier, is about that each day I try and prioritise myself for an hour to get to the gym, to get myself in the good headspace, because working in health and social care is challenging. I'm not going to sugarcoat it. It comes with lots of different challenges. So each day is that I set myself up, I'm in the gym, 5:30, 6 o'clock in the morning, train for an hour. For me, that's setting my day because my headspace is all in a good place already. And so with the team, when I go in, we have like what's called a 9:15 in the morning. So we all sit down, we talk about what our day looks like, what we're doing, what's going on. And I contribute towards that so they know what I'm up to, what I'm involved in, so they're aware of what I have going on. Yeah. But another thing that, kind of just touching on that possibly missed out is that each month we do an award which is called a GEM award, which is called Going the Extra Mile. So we put that out to our team, they all get nominated. It's a nomination by other caregivers within our business. And so each month I get a list of all the people that have been shortlisted, been recognised for going over and above, for their team, for their clients, for feedback, for recognition, all of that stuff is really important. So one of the things I always do each month is that I record a video of me in our training room, giving all the praise to the team, announcing the winner. And then we have like a digital wheel that I load up with a couple of pictures on. So we have runners up. Sometimes there's 2 or 3 runners up. We have an outright winner who has most votes. And then we have 2 or 3 people. And that spins around on the TV and it's all live. We have bloopers in there, which is fun. And that video sometimes can be 4 minutes, 5 minutes, whatever it might be. But that gets posted out to the team, which is a recognition to them as well to say thank you, for the hard work. And then we come in, we've got a wheel, which is like a Wheel of Fortune wheel with lots of different prizes on, and they spin that, and then the team are in, and they get recognised for that. So for me, it's about the biggest thing with being in business and having set up 2 businesses, is always being recognised for for the hard work that I've done. So for me, it's setting my day up, putting my best foot forward, and really valuing what my team do, and show gratitude. And at the end of each day, I walk out the door and I say thank you for your work today. It's 2 little words to say thank you for the efforts they put in. And for me, I know that the team love that. They respect the fact is that I'm grateful for the hard work and commitment they do to our business in a sector that is challenging.
Yeah, please and thank yous are free, aren't they? And I think in particular, when one is so busy there's that thing about, well, as a leader, I need to serve the people that I'm leading, which means I don't have time to look after myself.
Yeah.
But to actually carve out that time, and it doesn't have to be getting up at 5:30, although that works for you. It could be just going, make sure you go out for a walk, you know, get off the bus a bit earlier, or make sure you just get that walk around the block, you know, just to give you that time to yourself, rather than feeling you have to serve yourself as much as you need to serve other people, don't you?
You do, and if you don't look after yourself, all of a sudden you feel like you're burning out.
Yeah.
You know, it's an hour a day, and just that time allows you to reflect on what your day looks like ahead. I'm very much an early bird. You know, come the evening, my day's kind of done. I start early, and that for me is the part of my day that allows to set me up. Yeah. And you know, I believe in now is it's important to take time for yourself, because if you don't, you burn out. And it's quite quick, you know, running businesses, I'm sure as you well know, Ro, is you can burn out quite quickly, because you're doing 60-hour, you know, weeks, and you're so involved in it, you don't actually take the time to step back. Or because, you know, we're parents, you know, dads, all of a sudden it's work, kids, school, it's that whole, like, what I call the hamster wheel. And at any point in that, it's like, where do I actually get time for myself? You know, and we can all carve it out, but it's just finding that time and being disciplined enough to do it.
I think that is true. Is that, and I've been there so many times, probably never nailed it properly, but is choosing to take the time, and rather than saying I haven't got the time, never going to have the time to do that. That's the excuse, I didn't do it. Is choosing, and I've gone down to quite a granular level of tracking everything that I actually do. And when you do that for 2 weeks, although it's a pain in the arse, if you do it for 2 weeks and you look back, you go, whoa. There is chunks of time that I've spent doing the wrong thing. Yeah. Something that either I could ask somebody else to do who's not very busy, or something that I shouldn't be doing, or I don't enjoy doing. And when you look at it like that, you go, and then you distill it, you go, actually, there is at least an hour a day.
If you can afford to lose it, as in if you look at an hour or half an hour and you think, could I easily lose this doing something else, like being inefficient in thinking about a problem, or having too long meetings, because actually you can lose it. And I found as well, it's it's really important to be able to take that step back from things, because otherwise you are going to be just head down. Head down for yourself, because you're like in yourself and you're kind of focusing on just the kind of nuts and bolts of the business, rather than just going, let's take a step back and actually do that. And actually when you do that, you feel so much better. I find even when you put stuff in the diary, and even if you don't do it, you know it's in the diary, as an expectation that, okay, I will get to that point. We can be hard on ourselves, can't we, in terms of, oh, I didn't do that this day. It's like, well, no, there's the next day, next day. Get better, marginal gains and all that. It's really important.
Very interesting point you touch on marginal gains. One of the things for me personally was that trying to avoid meetings for having meetings, because it's pointless exercise. There's sometimes no need to have a meeting. But also look at, every day I used to go into, especially in the media world, it's very different, because I'd done such a long period of time, and running a business within that side was a lot easier. Whereas on the health and social care side, I used to get frustrated because I'd set my agenda for the day, I'd write in a notebook all the things I need to complete. At the end of the day, I'd be like, I've got nowhere near that. So I started to get really, really frustrated and started beating myself up. So then I took a step back, I had a half day off, and said, right, how can I adjust my balance to not getting myself into that position? So, and my philosophy for that was basically, if I complete 1 or 2 tasks off that list today, I've achieved something in the health and social care sector, and stop being so hard on myself.
Yeah. But, you know, it is a brilliant way of looking at it. So I think there's a Barack Obama, I can't quote it specifically, but something that I do, which is I have a very long list of things to do, and then I prioritise 4 of them, which at first I couldn't get my head around. So I'm like, I've got to at least do 20 things today. But if I do even 2 of those 4, it's exactly what you just said. I'm like, I've just done 2 really, really important, urgent things that are going to make a difference. Then at least you've done that. At least you've achieved. And quite often you find that you do more than that. Going back to what you were saying before, so you have your morning huddle. What do you call it?
Yeah, 9:15.
9:15. So, but if you're coming into that right frame of mind, having gone and done your bit for you, looking good, feeling good, that's a leadership trait that rubs off on people. And in healthcare, there is a big danger of burnout, isn't there? And I think it's really encouraging for team members. You know, I would love to think that I do the same when I am into running and going out and getting fit and getting everybody to upload their steps for the week and stuff like that. They probably hate me for it, but is to try and just rub off on other people in a positive way. I think it's that important.
It is, yeah, definitely. You know, with the team, that quick meeting, everyone gives off their points of what they're up to. You know, some of the team now get involved in going to the gym, eating healthy, stuff like that. So it kind of, you bounce off one another. And it's the mindset as well of, you know, your team see you in a good place, they want to get in a good place. And it's just, you know, I'm really proud I've got a really, really good team, and they all work really, really hard, and, you know, they're just fantastic, really. That's all I can say about them.
Yeah, excellent.
Well, look, you know, you're clearly passionate about what you do. It's been a great chat.
Yeah.
Really appreciate it. And, well, I'm sure we'll be picking up the conversations further on in the future.
Yeah, I hope so.
Definitely. No, thanks for having me. It's been good. Really enjoyed it.